As a record, just setting up the live stream, and then I'll go ahead and I'll just be muting everyone, and then we will start. Yep, that has started. I'm just going to record as well. We have Aditi who has joined. I'm not quite sure I recognize Aditi. Who's Aditi? Also, everyone just keep your videos on. And that way I know who you are. Sometimes the name says Zoom user and it's not very clear who you are. I just need to know who Aditi is. Oh, okay. Anyways, we have Nikolai here as well. Okay, I'm just going to go ahead and mute everyone now so we can start the talk. Okay. All right, here we go. So this is the topic for today. The most impactful strategies to prevent osteoporosis. So how to build strong bones. Now, any of you who are wondering why we're talking about this topic today, the reason is because, as we know, for metabolic health, for conditions like fatty liver, prediabetes, these things happen in a person who is genetically predisposed and has generally an imbalance in the ratio between visceral fat, which is belly fat, and non-fat tissue, which includes bones and muscles. And so building strong bones kind of ties in with building strong muscles. And when you have strong muscles and bones, you not only do you improve your metabolic health, but there's so many other benefits as well. So let's just quickly talk about the benefit of having stronger bones. We know that as we age and we have hormonal changes, particularly for women, perimenopause and menopause, inactivity, nutritional issues, all of these tend to shift the balance from losing more bone rather than gaining more bone. In our bones, we have these cells. The osteoclasts are responsible for absorbing or losing bone, while the osteoblasts are responsible for bone formation. And as we age, hormonal changes, inactivity, nutritional issues, all of them can start increasing bone losing activity and reducing bone gaining or bone strengthening activity. Of course, and one more thing to remember is that bones are not only just for your metabolic health, they're also that's something that's extremely important for independence. In fact, if you vision or imagine a person sitting in a nursing home who is unable to get up from his chair to go to the bathroom and is waiting for someone to help him or her get to the bathroom. And there could be another person the same age who is able to walk and trek and go for hikes. The primary difference between those two individuals is the difference in muscle mass and the difference in bone mass. And so this can be a big determinant for your independence later in life. So it doesn't just affect metabolic health, it also has a huge impact on your quality of life when you're independent later in life. Also, it can have a big impact on essentially risk of death. There is data showing that if a person falls and breaks their hip, then 20 to 30% of those individuals will die within the next 6 to 12 months. And this is due to their complications related to surgery, related to the fracture itself, loss of mobility, and that can also lead to other complications like pneumonia, blood clots. And so the 6-month survival after a hip fracture is worse than almost every cancer. And so it's really important to understand we pay a lot of attention to sugar and blood pressure and cholesterol and we pay a lot of attention to cancer screening. We also need to pay attention to the strength of our bones because it can impact our metabolic health. It can impact our quality of life and our independence. It can also impact mortality rates later in life as well. So we need to pay attention to our bones. One of the most important and most common myths hear about bones is that it's all about vitamin D and calcium. Now, while vitamin D and calcium are important, they are by no means the be all and end all. And by far, the most important factor for bones is the utilization of bones. Just like we say, if you don't use it, you lose it. The same applies to muscles as well. You don't use it, you lose it. And the same applies to bones. Bones are there to for mechanical loading. If you stop loading the bones, you start losing them. Doesn't matter what your vitamin D and calcium is like. Vitamin D, calcium, and other nutritional kind of supplements are really there to aid with the process of strengthening your bones because of loading. It's a bit like consuming protein and thinking just consuming protein is going to make you gain muscle. That's not the case. You need to do resistance training to gain muscle. Protein is there to help with that process. The same applies to calcium and vitamin D. Another very important concept to understand is the concept of the weakest link. Like if you're trying to pull a chain and the chain breaks, the chain doesn't break because of the strength of the strongest link. It doesn't break because of the average strength of the links. It breaks because of the weakness of the weakest link. That's why the chain breaks. And the same applies to the bones. If you fall and you break your bone, it doesn't apply because of the average strength. It breaks because of the weakness of the weakest part of that bone. That's really important to understand. And that is why the most important types of exercises often will be what we describe as multidirectional plyometric exercises. Why is that? Because these are exercises which load your bone from various different sides in various different axes. And so they strengthen various type parts of the bone. So if you do traditional repetitive exercises, and the most common thing I hear people say is, I'm going to go for a walk in the evening. Well, the problem with doing repetitive single directional exercises is that they load your bone in just one direction. So one part of your bone might become very strong, but there will be other parts of the bone which don't get loaded and stay weak or keep becoming weaker. Instead, exercises like I have some examples here at the bottom: jumping jacks, skipping rope, sports like squash, tennis, basketball, dancing like Zumba. These things are much more effective at strengthening your bones because you're doing various different types of movements. You're loading your bone in different directions. That has more value for strengthening bones than just going for a walk, for example. So now we'll get to the meat and potatoes of the talk. The most important strategy is resistance training, lifting weights. It could be free weights, it could be machined weights, it could be a resistance band, it could be your own body weight. But pushing something, pulling something, these are what strengthen bones. Because at the end of the day, the muscles are attached to bones. When you strengthen the muscle, the bone by itself strengthens. This was a study, the Lift More study, 2017, randomized controlled trial, 8-month study. In one group, they did high intensity resistance training, which means they were lifting 80 to 85% of their 1 rep max. 1 rep max is the maximum weight that you can lift in one go. In the other group, and this was an 8-month study, they did just low intensity home exercises. Now, this could be something like yoga, Pilates, gentle stretching. And what they saw in just 8 months, and I'd like to highlight, we don't even repeat bone density within 8 months. The minimum we wait for bone density is 1 year. Usually, we're repeating bone density at 3, 5, or 10 years' time. And within 8 months, they saw that in the stretching or low intensity exercise group, there was a 1.2% loss in bone density in the back and the spine, but there was a 2.9% improvement in the high intensity resistance training. In the hip, there was a 1.9% reduction in bone density within 8 months, while there was a 0.3% improvement. That's quite a significant improvement compared to just doing stretches. The conclusion is high intensity exercise compared to gentle exercise gives you a statistically significant improvement in bone density. Any of you who like reading science papers can click on that link there. There is one very important safety principle for those people who already have soft bones or brittle bones or already have osteoporosis. Whenever you do any kind of weight training, you must maintain a straight back posture. That's extremely important. And that's because, why is it important to maintain a straight back posture? Okay. Now, all of you have probably seen that when older people, their bones start getting softer. What happens is, one, they start shrinking in height. That's the first thing which happens. And the second thing which happens is that their spine starts pushing forwards. If you look from the side, they start becoming more bent forwards. So why does that happen? The reason that happens is because if you look from the side, the spine looks like blocks on top of each other. But these clients, they start suffering what we describe as vertebral insufficiency fractures. So they're essentially, their bones are fracturing. Oftentimes they don't even realize this. And usually the fracture happens at the front of the square. So if it's like a cube, it's happening at the front side. So instead of looking like a square, the spine starts looking more like a pyramid or more like a Toblerone square. It's shorter at the front and it's taller at the back. And so because of all of these triangles stacked upon each other, the spine, instead of looking straight, starts looking bent forwards because all the blocks of the spine are fracturing at the front and turning into, instead of a block of squares or cubes, it is now a block of triangles or pyramids. So that's what we describe as anterior vertebral insufficiency fractures. And the reason it's important for a person with osteoporosis or osteopenia to maintain a straight back posture during exercise, because the last thing we want to do is load the spine, because let's say we're making the person do deadlifts, which I wouldn't recommend any free weight exercises. If anything, you should probably be doing machine weights or body weight exercises. Very minimal free weight exercises because it's a bit risky. You shouldn't be doing it with a bent spine because the last thing you want is to cause yourself a vertebral fracture because of loading your spine while it's bent. So very important, any person who already has soft spine, always maintain a straight posture. So if you were to sign up on, and there are certain programs, I will mention it on the blog as well. I believe it's called the Osteo Strong exercise program. I think it's US based. And virtually you can learn exercises. You might even want to go on their website. But if anyone, any trainer, any expert tells you to do an exercise which has a bent spine, don't do it. Always maintain a straight spine when you're doing any kind of exercise. Let's have a few questions and answers before we move to number 2. Out of those 5 things to strengthen your bones, let's have 1 or 2 questions. Just unmute yourself and ask a question, or you can just raise your hand on Zoom. Mr. Gramanis has a question. Mr. Gramanis, please go ahead.
Yes, doctor. I know that you've done a bone density test on me before. Can you tell us what you see when you do a bone density test, please?
That's an excellent question. Thanks for the question. So a bone density test is purely a comparative test. What we see on a bone density test is a T-score. We call it a T-score, which essentially is comparing the density of your bones to the density of another person who would be the same gender and the same age as you. So if you are a 55-year-old male, it is essentially a comparison of your bone to the average 55-year-old male. And so how it works with the T-score, if you score 0, that means you're average. If you score pluses, that means you're better than average. And if you score minuses, then you're less good than average. If you score between 0 and -1, that is still considered to be normal. You're a bit less than average, but you're still normal. If you score between -1 and -2.5, that is called osteopenia, also called borderline osteoporosis, between -1 and -2.5. And a score below -2.5 is considered to be osteoporosis, which requires medication. Now, if a client has a score below -1, which means osteopenia, however, suffers a fracture, and the fracture could be observed like, you went to emergency room, you fell down, you broke your wrist, or it could also be something picked up on an x-ray of your back which shows a vertebral insufficiency fracture, which you might not even be aware of. In both cases, we would still treat that patient with bone sparing medication. So bone sparing medication is used for people who have a T-score -2.5 or have a T-score -1 but suffer a fracture, either clinically evident or something found through further investigation. Yeah, that's a great question. Great. That's a good segue to move to next part of the talk, which is the second most important thing out of the five most important things. So number one was resistance training. Number two is, we actually alluded to this, and this actually talks, is a really good point. A bone density is not the be all and end all. When we do a bone density test, we measured the density of the bone at a certain part of your spine and a certain part of your hip. However, remember, the strength of your bone is not determined by the strength of your average bone or the strength of the strongest part of your bone. It's actually determined by how strong the weakest part of your bone is, and that is not found out through a bone density. So a bone density could actually be misleading you. The best sense you can get of how strong your bones are is actually by how much you can lift, how active you can be. Now, are you able to be active? Are you able to play sports? Are you able to do Zumba, jump? Are you able to skip rope? Those kinds of parameters are probably more determinant of how strong you are than a bone density test. And that's because a bone density doesn't tell you how weak the weakest part of your bone is, because that's the part that's going to break when you fall. Like we talked about the chain. When you pull a chain, it's the weakest link that's going to snap. The average chain strength doesn't matter. The strength of the weakest link is what matters. And plyometric and multidirectional impact loading is what is most effective for strengthening every part of your bone. So this was a nice study done in 2013, 12-month study, randomized controlled trial. And they had a control group and they had another group which did high impact multi-directional exercises. And again, they saw a decline in bone density in the control group. They saw a 1 to 2% increase in bone density in the exercise group. For spine, same for hip, they saw a decline in the control group and they saw an increase in the hip group. Next, let's talk about structural proteins. Making sure that you're doing resistance training, making sure that you are doing some plyometric exercises. This could be jumping jacks. This could be, skipping rope. It could also be basketball, tennis, squash. It could also be, playing any kind of sport. It could also be dancing, like Zumba, for example. But once you start doing that, your body now needs some nutrition. And the main two proteins would be essential proteins, which are useful for building muscle, and also proteins which are useful for building bone itself. And that would be protein and collagen. So this is a study done by Bonjour et al. 1998, 6 months, fairly short, randomized control trial in which they had protein supplementation in one group and the control group didn't. And in the protein supplementation group, they saw an increase in IGF-1, which is a growth marker of bones, by 10 to 20%. And they also saw reduction in bone loss versus control in that group. Now, bear in mind, in the first two studies we talked about for exercise, there was no, it didn't say it showed a reduction in bone loss. It said it showed an increase in bone loss. That's why those are the more powerful uh, interventions. This is not as powerful as exercise. This intervention didn't show an increase in your bone density. It just showed a reduction in the loss of bone density versus control. So, I mean, it's welcome, but don't think that consuming protein or collagen is going to be nearly as strong as resistance training or plyometric exercises. And so it's really, when we go on social media and you see all of these people giving you these magical supplements, what they don't tell you is the impact of those supplements. They don't tell you this is effective, but how effective is it? Is it more effective than exercise? Is it less effective than exercise? And so it's really important when you look at any supplements, you need to know the impact factor. Is this just supplementing the exercise, diet, other aspects, or is this good enough on its own? Clearly not good enough on its own, but can be useful to supplement your exercise and your plyometric exercises. Similar story with collagen. 12-month study, double-blinded randomized controlled trial. So good design of study. One group got placebo, the other group got collagen. They actually saw increase in bone density in the spine and also an increase in the bone density in the hip. So that's quite a nice study. Of course, we know that bone is made of collagen. However, still, it's only one study, so you can't really make very big you can make very big assumptions by just one study. I mean, it was a well-designed study. It was done in Germany, so it's not like coming out of some, sometimes you get studies, single study, which come out of very unknown places, and sometimes they're just trying to make a name for themselves. But yeah, this was a decent study, but you can't really make huge assumptions by just one study. So that for that reason, I would still keep it at number three after resistance training and plyometric exercises. And of course, you know that I don't recommend beef or cow-based supplements. So if you go on my blog about supplements, you'll notice I recommend a marine or fish-based supplement. And for protein, I recommend a plant-based supplement. Um, Number four, micronutrients. These are things like calcium, vitamin D, vitamin K, and magnesium. These are all important for your bone density. Let's go through a few studies. And then we'll have one more question answer round. In this study, it was a long study, observational study, placebo group, calcium, vitamin D. Uh, there was slight increase in bone density, 1 to 2%. However, there was no reduction in fractures. So, take it with a pinch of salt. There appears to be some benefit, but it's not the be all and end all. This is a study of vitamin D in which it did show a significant reduction in falls if you take vitamin D, so there's definitely some benefit. This was a study of magnesium. Uh, it does appear to increase bone turnover markers, so that is some second-hand data. There's no strong data to show for bone density or falls. Vitamin K, again, same thing, did show a slight reduction in the loss of bone, but no increase in bone. So again, probably good supplement in the overall supplement strategy, but not strong enough on its own. And finally, I'll just talk about two supplements which can also be beneficial. This is something called soy isoflavones. Soy isoflavones are what we describe as phytoestrogens. We know that one of the biggest accelerators of bone loss are after menopause because of loss of estrogen. Now, of course, estrogen in the form of menopause replacement therapy can be considered in those clients who do not have any risk factors, uh, and also those clients who, for the first 10 years or so and under the age of 60. Once you pass age 60, it's generally not recommended. Also, if you've taken menopause therapy for over 10 years. And so those clients could definitely be considering some soy isoflavones. You can get this through increased soy in the diet as well, through tempeh, and tofu and soybean edamame, etc. But you can also consider a supplement. In this study, the soy isoflavones did show a modest 1 to 2% increase in bone density. So that's not to be sniffed at. Uh, some people think soy increases risk of thyroid problems. There is no scientific evidence for that. As long as you don't consume the soy within 1 hour of thyroid supplements, there is no problem. Also, some people think soy increases risk of breast cancer. That's completely false. If anything, it's the exact opposite. There are a lot of studies which show that soy reduces the risk of breast cancer. And the final supplement I want you to be aware of is creatine. Creatine is something which increases the effectiveness of exercise by increasing the energy within your muscles. So if you don't mind me getting a bit nerdy with you, when we talk about protein powder, we are essentially targeting three main branching amino acids, also called essential amino acids for MPS or muscle protein synthesis. These are amino acids leucine, valine, and isovaline. When we talk about collagen, we're looking at particular amino acids which are more useful for type 1 and type 2 connective tissue, which is bone, for example. And this is essentially proline, hydroxyproline, and glycine. While creatine is also made up primarily of three amino acids, which is useful for increasing the amount of ATP in your body, in your muscles, and your brain as well. So increasing the amount of energy that you have, so it makes the exercise more intense and leads to more, not just more muscle growth, but there's some evidence coming for memory and for cognition as well for creatine because it increases energy within your brain as well. And so creatine is primarily made up of amino acids, methionine, arginine, and glycine. And so, for bone density specifically, there was some trend towards improving structure of the hip, but there was no significant bone density change in this study. But if you are to take creatine with muscle with resistance exercise, it does improve the amount of muscle you build, and then it does improve the amount of bone you build as well. So that was about supplements. I would urge you to check out I have put the link in the reminder that you would have received, which is this one. Supplements. There are various other blogs you could check. Supplements for exercise, supplements for menopause, for osteoporosis, for vitamin D, multivitamins. But if you went to the osteoporosis blog, you would find all of my favorite supplements. This one is calcium with magnesium. So it's a good combo of calcium with magnesium. This is vitamin D with vitamin K. So again, you're just taking two supplements and you're getting four. So you're combining them, calcium with magnesium, vitamin D with vitamin K. My favorite, organic is a good brand for supplements. You can get it from Costco as well, a much bigger pack you can get from Costco if you like. Protein powder, my favorite is for women, you can consider soy protein isolate simply because as we saw, soy itself also has beneficial effects for your bones. You could probably alternate it with this plant protein, which I quite like because it's a plant protein and also contains many other beneficial things like you can see here 1.5 billion probiotics, CFU, colony forming units, also superfoods like berries and kale and avocado and all that kind of good stuff, along with 20 grams of protein powder as well, and fiber as well. Also contains fiber. You can see here it contains what 7 grams of fiber. Not the average American consumes 12 grams of fiber per day, and here you're getting 7 grams of fiber in just one scoop. So I always prefer if you go to Costco and just pick up any protein powder, you'll end up with a cow-based protein, but this is a plant-based protein. It actually has less protein per scoop, 20 grams, while like your typical Costco protein will be 25 grams of protein. But I value the other stuff that a plant protein contains, including fiber. Even contains looks like some omega-3 as well in there on the food label. Creatine. Again, I don't like cow-based stuff, which is why my creatine is a vegan creatine. So it's not animal based. 5 grams a day would be the dose of creatine if you decide to take it. Take a daily multivitamin. I recommend the Jameson brand ones. You can pick up the 50 plus if you're 50 plus or under 50. And for isoflavones, my favorite brand is a CBI soy isoflavone. $30, but you can see it's 120 capsules. That's a 4 month supply for $30. And this would go some way in supporting bone health, particularly for perimenopausal or menopausal women, because it contains phytoestrogens. Yeah, so you can check out the blogs for that. Next section, we'll talk about diet, but before we talk about diet, let's just have some more questions and answers. Yep, some more questions and answers, guys. Q and A's.
Dr. Howard, I just want to ask a quick question as it relates to the supplements, and some are oil soluble and some are water soluble. What's the best time? Like, which supplements can you take together? Like, for example, my husband and I had a discussion, and he was saying magnesium shouldn't be taken with I don't remember if it was vitamin D3, and we had that conversation, and I said I would have researched it. So is it that some vitamins are best to take by itself, like calcium and magnesium? Can you combine them, or do you take them at separate times?
Yeah, I mean, there's some general rules around supplements. So, for example, magnesium is a relaxant type of supplement. So, often people will use it when they have sleep problems. And so, it's probably better taken in the evening or nighttime. The same applies to melatonin. Melatonin is also a relaxant type supplement. So, if someone's taking some melatonin, better to take it evening or nighttime. With iron, it can interfere with the absorption of well, iron can cause is better absorbed if you take vitamin C with it, so that's something you might want to do. It can often cause constipation and stomach cramps, so some people would like to take some metamucil, or on my gut health blog I have inulin powder, which is a resistant starch, so you might want to take some fiber with the iron if you're taking iron. You make sure you don't take any supplements about hour from any thyroid medication if anyone's taking thyroid medication. In fact, you shouldn't take any food an hour after thyroid. So these are some general rules. But personally, in the morning, I get all my supplements mostly in the morning. If I make a smoothie for myself, I will put some fiber. I'll put some protein powder in there. I might, then I'll gulp, as I'm gulping it down, I'll be taking my multivitamin, my hyaluronic acid. I take oral hyaluronic acid as well with biotin and vitamin C. I take my omega-3, the same one on the blog, the triple strength one you can get from Costco as well. So I take those three plus so multivitamin, vitamin D, and I take my hyaluronic acid in the morning. And in the smoothie, often I'll have the plant protein powder and I'll have the what you call the fiber. And then often in the coffee, I'll be adding in my collagen, scoop of collagen in the coffee. Some all more rules. If any of your supplement contains probiotic, then you cannot heat it because probiotics get killed by heat. So you can put collagen powder in the coffee, but you can't put your plant protein powder in warm heat because it's contains 1.5 CFU of probiotic. So it's something else to bear in mind. That needs to be mixed with cold liquid, while collagen can be mixed with hot liquid as well. So those are some general rules, but most of the supplements I take in the morning. The only ones I would take definitely in the evening would be magnesium and melatonin. Yeah. Great. Looks like Rakesh has a question. Rakesh, go ahead.
So, a very basic question first. Like, when you say osteoporosis, like it is, I understand it's like something to do with bones, but what exactly? What are the symptoms of it? How you can, manage it if it's an early onset or whatever that might be. Like if you is it you start having pain somewhere? What are the common symptoms of it? Just to monitor
Yeah,
it.
so osteoporosis for most people has no symptoms at all early on. For at least 10, 15
Mhm.
years, no symptoms at all. The people will sometimes jokingly say to me, Doctor, oh, looks like I'm shrinking in height. And that could be the only symptom you have. You're just shrinking in height. and your spine is becoming increasingly bent forward. So any person who's shrinking in height, consider getting a bone density test done, and perhaps even an X-ray of your spine to make sure you're not already getting insufficiency fractures of your spine. And then, of course, later, if you start suffering fractures, if you start getting back pain, particularly upper back pain, osteoporosis tends to cause more upper back pain than lower back pain. And then, yeah, by that time already is a bit late. I mean, today's talk is more designed to prevent osteoporosis through diet, exercise, etc. By that time, you're already getting into the zone of medication, the zone of injections, and all other kinds of more specialized things.
Mm-hmm.
Yeah, but essentially, if a person, females are at higher risk than males. People with lower body mass indexes are higher risk than people with higher body mass indexes for osteoporosis, simply because just by having a bigger body, you have more muscle because you have to spend more energy to move around a bigger body. So a person who's a large person, don't be surprised that if your bone density is actually quite normal because your bones are having to do work just to move a bigger person around. But the frailer people tend to, especially postmenopausal females, tend to be the highest risk for osteoporosis.
Mm-hmm.
But yeah, but it's never too late to try to prevent something, which can be a major problem later in life. Yeah. The guidance says that people should get their bone density tested from age 65. This is one of those areas where I'm not in agreement with the guidance. I think it's way too late to wait till age 65. So even after age 50, if someone asks me for a bone density test, I'm generally quite happy to arrange it. Yeah. And if any of you haven't had a bone density and are above age 50 and thinking of doing it, then we do have those Google forms on the signature of our email. Just and there, one of them is how to request something, or request a blood test, or request imaging. Just put in a request for bone density, and we can arrange that for you.
Is it OHIP covered, doctor?
After age 50, it is OHIP covered. Yeah.
Oh.
I mean, it is covered before age 50 as well, but in some very unique situations, like a person who is on anti-estrogen therapy for breast cancer, for example, or a person who's had early menopause. Like I had one girl who had early menopause from 38. So in those situations, it would be indicated earlier. But otherwise, generally, the recommendation says age 65. But personally, I'm quite happy to arrange it from age 50 onwards. Similar to how I recommend prostate cancer screening for men. I tend to say that from age 50, if you want to get a PSA blood test done for prostate cancer, I think that's quite reasonable. Great. We have 20 minutes left. Let's go through the final section of the talk today, and then we'll then finish off with more Q's and A's at the end. All right. So remember to check out my supplements as well. And so let's now talk about diet for healthy bones. So, okay, 1 second. So these are all the things that you need to have in your diet. Calcium, that's the base of your bones. What things contain calcium? Now, you probably know already, I'm a big fan of low-fat dairy, 0% dairy, 0% Greek yogurt, low-fat mozzarella cheese, low-fat kefir, because I love dairy for the calcium and the probiotics, but I don't like it for the saturated fat. And so skim milk, low-fat yogurts, low-fat kefir, skimmed cottage cheese, these are great for calcium. Calcium is also present in plant-based sources like calcium-set tofu, plant-based milks like soy milk, and of course for females, additional benefit of soy milk because it contains soy isoflavones, which is a phytoestrogen. Plant-based milks are often supplemented with calcium. Even plants like bok choy, kale, broccoli, collard greens contain calcium as well. And marine sources can include canned salmon with bones and sardines with bones. Magnesium is also important for your bones. So spinach, Swiss chard, pumpkin seeds, chia seeds, flax seeds, almonds, black beans, chickpeas, lentils, all these plant-based sources contain magnesium, Whole grains like oats, brown rice, quinoa contain magnesium. That's why we don't like you to have white rice and white bread, because you lose the magnesium, you lose the protein, you lose the fiber when you refine the grain. Marine sources of magnesium include salmon and halibut. Vitamin K is important for your bones. Leafy greens, kale, spinach, Swiss chard, collard greens, romaine lettuce, they contain vitamin K. Also Brussels sprouts, broccoli, and cabbage. Of course, vitamin D, vitamin K, vitamin E, and vitamin D, these are all fat soluble vitamins. So if you pair them with a bit of healthy fat like some olives or nuts or seeds or fish, then you will get better absorption of the vitamin, of the fat soluble vitamin that includes vitamin A, D, E, and K. So isoflavones are phytoestrogens. They can go some way in reversing the menopause-related decline in bone health. And so soy foods like tofu, tempeh, edamame, unsweetened soy milk, all these contain soy. And of course, protein is important as well for growing muscle and bone. So the best sources would be marine sources like salmon, sardines, cod, tuna, trout, white meats like turkey, chicken, duck. Plant proteins are lentil, chickpeas, black beans, edamame, tofu, quinoa. We just had quinoa the other day. It was really nice. It's a source of complete protein as well, and good source of fiber. Low-fat dairy is excellent for high leucine content but low saturated fat. And creatine, also important for muscle growth and bone growth. And the best sources would be mostly marine sources, herring, salmon, tuna, cod. I mean, you can get creatine from steak as well, but red meat, it'll give you a lot of saturated fat. It'll give you a lot of inflammatory compounds. It'll also give you lots of calories. So perhaps not the best. I mean, lean source might be okay, but perhaps not the best. So how can you make your diet really good for your bones? High vegetable intake, especially leafy grains, are very good. They contain the vitamin K, the magnesium, high amount of plant proteins, because as we saw, soy, lentils, legumes, beans, chickpeas, all these are really good. Good amount of fish intake. I would say 2 to 3 times a week. You try to get some fish, even tinned fish, especially if it's with the bone. That'll contain high amount of calcium. It'll contain creatine. It'll contain so many other beneficial things. Low-fat dairy is excellent. Good source of calcium. Good source of probiotic. Good source of protein generally with low calories. And lean cuts of white meats, cooked, grilled, or steamed, or air fried, are all excellent. Duck, turkey, chicken. Try to avoid red meats because it's a saturated fat. And if you deep fry it, if you're having KFC chicken, that's not the best. That's going to increase your saturated fat. So just if you want to think, imagine a plate. Fill up half the plate with vegetables, things like leafy greens and cruciferous vegetables like cauliflower, broccoli, and cabbage, and kale. About a quarter a plate, some more protein like fish, poultry, tofu, legumes. About a quarter plate more with whole intact grains, things like whole rolled oats, like quinoa and brown rice. And add in some healthy fats as well, but not too much because these are very calorie dense. So maybe a serving of olives or nuts and seeds. And I included some daily RDAs in there in case you want to track yourself, track your diet using my tracking apps like Snap Calorie, Cal AI, Macro AI, Chronometer, MyFitnessPal. There are lots of tracking apps. If you want to track your diet, then these are some useful numbers that might be useful for you. And remember, you could go into any of these blogs. Like this is this blog for muscle growth, and I even include some of my favorite like plant protein powders in here. My soy protein powder, vegan creatine, omega-3, multivitamin, zero-calorie Gatorade, my favorite protein bars. This is a plant protein bar here, which contains a good amount of fiber as well. Collagen, hyaluronic acid I take for my joints, oral hyaluronic acid. And I even divided this into upper body push, upper body pull, core exercises, lower body, cardio, aerobic exercises, and I included Amazon links for examples of all of these. For example, if you want to increase your step counts, you can get this, which I have myself, like a mini elliptical. And although the pictures show you sitting down and doing it, you can even stand up on it and walk on it, but you need really good balance. But I walk on it myself. And so I included all the various exercises that you could consider doing for all of these things on this blog, which is called Supplements and Equipment for Muscle Growth. Great, we got 10 minutes exactly. We can have some more Q's and A's, and that'll be the talk. Some more questions. We've got Mr. Yemeni today, Mr. and Mrs. Yemeni. Let's have a question from you guys. You're muted right now. I can see you, but I can't hear you. Now you're muted. Yep, go ahead.
I keep on eating my protein bars with my ice cream?
Yeah, you can do. Just be careful with the ice cream. I do recommend the Halo Top ice cream, which is made from sweeteners. So it's got less sugar than a standard ice cream. It's called Halo Top. Some people get these Ninja Creamies, and you just add some cottage cheese or Greek yogurt to some fruit and some sweetener, and it comes up with this people say it tastes like ice cream. I'm not sure if it does or not, but some people get these Ninja Creamies as well to make something which feels like an ice cream but has got more protein and less sugar. Yeah.
Thank you. I should avoid store-bought orange juice, right? I should avoid.
Absolutely. Eating olives is better than drinking olive juice. Eating oranges is better than drinking orange juice. Yes.
Ne dediğini duyamadım. Thank you.
All right. Let's have some more questions, guys. I think Rakesh, you've come for the first time in a while. So Rakesh, let's have a question from you.
I don't know. Generally, like I tend to go with not with artificial supplements and all. Tend to get the supplements from the food as I don't know. That's the kind of mindset that I have. I don't know if it is common with people or just me. Like
That's such a good question. Let me
Yeah.
explain that to you in a bit of detail, Rakesh. Okay.
Mhm.
Okay. Let me explain that concept to you. Now, there is this thing called there is this concept called appeal to nature, and a lot of people are kind of victim to that kind of mentality, where everything that's natural is better. Forgetting that snake poison is also natural, and mercury and arsenic are also natural. But these are things that are obviously not very good for you. So not everything that's natural is good for us. I think what we need to understand is the food environment that we live in. So when we were cavemen and hunters, and we were running around farming and catching prey and plucking berries all day, and we didn't have fridges, we didn't have freezers, had no drive-throughs, we had no Uber Eats. The food environment was extremely different to how it is right now. And so in that environment, we ate everything that was natural, and we had a very healthy lifestyle. Now, the problem now is that we are completely surrounded with ultra processed, calorie dense, and very addictive food. You see, I'll have people saying to me, Doctor, I'm only going to eat natural, but they'll pour butter all over their food. And the butter is not natural. Butter doesn't grow on a tree. They pour ghee all over something, and that's not natural either. You don't find any chlorinated butter trees anywhere. Or they will slug a whole jug of oil in their food, and it's like there is no avocado oil trees anywhere. So these are also processed foods. Even the things that we consider natural, which is completely inert food, is not really that natural. All of these things are also coming from factories and industry. The problem is the natural food matrix has been taken away, the fiber has been taken away, and the food has become much more calorie dense and much more addictive. So for example, orange juice versus oranges. If you can just eat oranges, that's great. Eat 3 oranges, 4 oranges, maybe that might be like 50, 60 calories, but it'll give you fullness. It'll give you satiety. If you consume 3 apples, that'll be about 100 calories and it'll make you completely full. But if you drink 150 calories of apple juice, it'll give you no fullness because it's got no food matrix, it's got no volume, and it's got no fiber. So the point I'm trying to make is that we live in a food environment which is full of processed, factory made, industrialized food. And if we want to be healthy in that environment, i.e., we don't want to become people who start gaining a lot of belly fat and become victim to metabolic disease, heart disease, kidney disease, diabetes, etc., then we have to do what scientifically is useful for us. For example, let's say I use the nature fallacy and say I want to consume 5 grams of creatine because that's good for my bones. Now you have two choices. You could take a scoop of 5 grams of creatine and that'll be it. To get the same 5 grams of creatine, you would need to eat at least 2 steaks of beef. Now, 2 steaks of beef would be about 1,000 calories. It probably also increases your LDL cholesterol, increases your risk of heart disease. Let's not even talk about the risk of bowel cancer and other things which happen with red meat. And so the supplement is useful because you got the 5 grams of creatine without having to consume 1,000 calories, without having to consume saturated fat and everything else. Let's take another example. Let's say you said, I want to consume 20 grams of protein because I want to build more muscle. Well, you could get it through a protein powder. That would be about 150 calories. You could get it through, say, low-fat Greek yogurt. That would be about the same, maybe about 190 calories. You could get it through chicken. That would be about 250 calories. Or from white fish, that would be about the same. You could get that 20 grams of protein from, let's say, beef. That would be probably about 550 calories. You could get the same 20 grams of protein from a hamburger, which would be about 1,000 calories from a beef burger. So that scoop of protein powder, which incidentally also contains fiber, probiotics, vitamins, minerals, and everything else, might be a better deal than getting it from the shops. Because for the same amount of protein, you're getting fewer calories, you're getting fewer other things which might not be so beneficial for you. 0% Greek yogurt is one of the healthiest things you can eat. You're getting so much protein for probiotics, for calcium, and for very low calories. Technically, 0% Greek yogurt is not a natural food, it's a processed food. The point being, not everything that's natural is healthy, not everything that's processed is unhealthy. You really have to look at what you're trying to achieve. You're trying to achieve a more lean physique, more muscle, less belly fat, stronger bones, stronger muscles. If certain types of processed foods like 0% Greek yogurt, a plant protein powder, collagen supplement, creatine supplement, etc., can help you in that direction, more so than eating it naturally, personally, I see nothing wrong with that. But most people will neither be completely in one direction because they're not trying to become bodybuilders, nor will they be completely in the other, just do everything naturally direction because you don't want to live like a caveman. You don't want to follow a paleo diet and just eat just berries and meat. Most people will be somewhere in the middle. So they'll try to improve their diet and they will probably use some supplements as well. So I think the truth lies in the middle for most things. Both extremes are probably not very healthy. Trying to do everything completely naturally is probably not ideal. You'll probably never come up with a Olympic athlete or a sports person or a bodybuilder or a model who is not using any supplements. All of them are using supplements. I follow many of them. I follow the trainer for Ritik Roshan, for example. But I can tell you all the supplements that Ritik Roshan is using. He's not doing it by completely natural food. So, on the other hand, no one wants to be a caveman either, just eating natural all the time. The best balance is somewhere in the middle, and most people will fall somewhere in that kind of middle ground. Yeah, that's a good question. Let's have one last question, guys, and then that'll be it. The next talk, we'll be doing some more complex topics. We'll be talking about insulin resistance. Why does a person become pre-diabetic? We'll be talking about gut microbiome. We'll be talking about uh, other factors like inflammation, chronic systemic inflammation, and then we'll move back to nutrition and diet after that. So let's have one last question before we sign off. I see a bunch of people here. I see Edwin, I see Pajita, Priya, Vishal. Oh, Vishal's here as well. Yep. And Vivek. It's good. Mr. Grimanes, let's go ahead.
What's your opinion, doctor, on the carnivore diet? Because I hear a lot about it on the news, and I'm not very familiar with it, and I wanted to get your opinion on it, sir.
I'm really glad you asked that question. So the carnivore diet, I have a video on this topic. If you look at the heading is called Diet Lies. So if you go on my YouTube channel, it says Diet Lies. In that video, I talk about every diet. I talk about carnivore, keto, paleo, vegan, intermittent fasting. Even I talk about, even though I'm quite a big proponent of intermittent fasting. People who do extreme fasting for several days, for weeks, they go to these fasting retreats. I don't believe in any of that because that's just not the right balance. In that video, I talk about the benefits of every diet and the downsides. The problem is, you see, the kind of diet that I'm recommending to you is the kind of diet recommended by Harvard and by the Food and Drug Administration, by Health Canada. This is the standard academic diet. That's high fiber, high protein, low calorie density, high satiety. Problem is, you don't get a lot of social media clicks by recommending an academic diet because that's what every doctor tells you, that's what every person tells you. The influencers want to make it spicy, make it interesting, and so they talk about these niche diets and they promise you the world. All of these diets have certain benefits, but they have a lot of downsides. And so the carnivore diet, what's the benefit? Well, carnivore diet will clearly be a high protein diet. So if you're a bodybuilder, you might get benefit because you build a lot of muscle. That's really where the benefits end for the carnivore diet. If you're not having healthy carbs like whole grains, lentils, legumes, beans, chickpeas, etc., which contain a lot of fiber, then you'll be increasing your risk of bowel cancer, your sugar will go up, your cholesterol will go up, probably your weight will go up as well, because fiber has all those benefits. If you're not getting all the polyphenols, so the purple anthocyanins that you get within eggplants and purple cabbage, if you're not getting the red lycopene that you get within tomatoes and raspberries, or the red quercetin that you get within red onions and red potatoes, or the orange beta carotene that you get within bell peppers and pumpkin and squash, and all the polyphenols that you get within olives. These are all anti-inflammatory, anti-cancer compounds. The allicin that you get within ginger and garlic, the curcumin you get within turmeric. These are all anti-cancer, anti-inflammatory compounds with multiple benefits. I have a whole blog. I believe the blog's called Ozempify Your Diet. I will write a new blog on this topic. This is a fascinating topic. All the chemicals within these plant compounds which reduce risk of cancer, reduce risk of inflammation. If you're on a carnivore diet, how will you get all of those anti-inflammatory compounds? And so, sure, there's one benefit, more protein, but there are lots of downsides. Same with keto. Keto is a high-fat diet, low-carb diet. Again, same downside. If you don't have fiber and polyphenols, that's bad for your health. high fat diet, I mean, if you're just eating olives, avocados, nuts, seeds, and fish, sure, you can be on a high fat diet. That's healthy fats. But if you want to have 60% of your calories from fat, you're gonna start consuming, all the unhealthy fats: beef, red meat, lamb, goat, uh, deep fried foods, ultra processed foods which contain palm oil and coconut oil. And so you're going to increase the risk of heart disease. There was a study done in British Columbia which showed that people on a keto diet would have a heart attack about 15 years earlier than people not on a keto diet. So sure, I mean, you might lose some weight, mostly water weight, because if you're not eating carbs, but you're going to increase the risk of dying. So I don't see much benefit of a keto diet. Vegan diet, high in fiber, clearly, high in polyphenols, clearly, but often, if not structured properly, can often be low in omega-3, low in protein, low in other things like iron. So there are downsides, low in probiotics, because vegans are not even allowed to have yogurt, for example. That's not very healthy. I mean, yogurt is one of the healthiest foods you can consume, especially low-fat yogurt. Paleo diet means just eating natural foods like a caveman, like a Paleolithic diet. I mean, sure, you won't be eating whole foods, you won't be eating processed food, so yeah, I can see benefits in that. But it's more strict than it needs to be, When you go to the gym and you need to get your protein intake up, there is a benefit in consuming that protein powder or consuming that plant protein bar as you're driving back from the gym. I mean, it gets my protein intake up. If you were on a paleo diet, you'd be munching on chicken leg on your way back to the gym. I mean, you don't need to do that. You can consume processed foods like 0% Greek yogurt and protein bars and protein powder, and it'll be more convenient. And so it's just overly strict. There's one diet also, fasting. Fasting is a form of a diet culture as well. If you're just focusing on consuming more calories earlier in the day, not consuming late in the day, if you're focusing on trying to keep at least 14 hours gap, 12 to 14 hours gap between an early dinner and an on-time breakfast, I see a lot of benefit in that kind of mild fasting structure. But if you start doing long fasts where you're not then getting your adequate protein intake, you're feeling tired all the time, you can't exercise, you can't do cardio. I mean, if a person hasn't eaten for 18 hours, how is that person going to do any cardio? Then you're going to start losing muscle. You're going to get into skinny fat territory. And that's what I see with people who take Ozempic, Mounjaro, Zepbound, Wegovy, all these weight loss drugs. They're feeling nauseous. They're feeling vomiting. They don't exercise. They don't do the cardio. That's why we have to monitor them. And that's why those clients are recommended to be part of a coaching program so that we don't take the dose up so high that you can't do your exercise and do your cardio, because our goal is not just to lose scale weight. Our goal is to lose body fat at the same time maintaining muscle mass and maintaining your cardiovascular health. And so I see long fasting as a similar thing to excessive dosing with Ozempic, Mounjaro, etc. Very similar. You just turn into a vegetable, lying in bed, not doing any exercise, not eating any food. You lose weight. You're kind of shriveling away. You're kind of disappearing away, but it's not a healthy way of doing it. There are much healthier ways of doing it. And so yeah, just check out my video. But the way that I describe it, which is kind of the Harvard academic approach of diet exercise, is unfortunately the boring way of doing it, because this is what every doctor or nurse or dietitian who is trained in diets, nutrition will coach you on this kind of technique. All the fancy influencers on social media, they try to give their own spin to it, but there are lots of holes in what they try to explain to you. All right, let's have one last question, Vishal, and then we'll sign up. We'll sign off then. Vishal, last question.
Yeah, I was just listening to the conversation you were just having. So I think I see lots of athletes moving to vegan or like vegetable diet. Like they are like moving away from the animal-based proteins. But few have like a strict discipline, like an 80-20, like 80% vegan vegetables and 20% and like animal protein. So, what balance you recommend when you say that not extreme is good? So we should have a balance. So what balance do you recommend as a non-vegetarian, right? So we have
Yeah,
both
so
vegetables.
the balance, I mean, generally, when I ask people to track their calories, what I say to them is this is your calorie target. And then for protein, I like to divide the days into resistance training days, muscle building days, and I divide it into fat burning cardio days. For example, today is a fat burning cardio day. Already I've done 10 minutes of exercise, of cycling, and I've done 10 minutes of elliptical. I'll do a run outside. I don't think it's raining outside today, so I'll do a run outside. And if you look at my calorie intake, so far I haven't consumed a lot of calories. I've only consumed about 811 calories so far on Snap Calorie. Not a huge amount of protein. The protein has only been about 45 grams of protein. So on my fat burning days, I focus more on my cardio. And even if I can hit 0.8 grams of protein per day, I'm happy with that. On the other hand, on my resistance training days, I consume much more protein and I do more calories on those days. So my answer to your question is, and then of course for fiber, 20 to 40 grams of fiber per day. Healthy fat could be anywhere from 20 to 40% of the calories from healthy fats. The point being, it doesn't matter if you're doing vegan or vegetarian or a carnivore or anything else. You need to hit your targets. If a person who is vegan is not hitting their protein targets, they need to consume some plant protein powder and some collagen powder and hit those targets. If they're not getting enough healthy omega-3, they need to perhaps take an omega-3 supplement. If they're not getting enough iodine or something else, they maybe need to take uh, a multivitamin and make sure their salt is iodized. So you could be on any diet, but the rules for the targets are the same. And so, according to your diet, you will have to then supplement it accordingly to bring it in line with what the recommendations are.
Okay, got it.
Yeah. So a person who is just carnivore would be getting plenty of protein, but that person might need to take protein fiber supplements and maybe take some plant protein so that it also contains vitamins, minerals, and antioxidants and other stuff. They may need to consume perhaps other kinds of supplements to not get the as much of the downsides of their carnivore diet. So you could be in any diet. You just need to know what to target, protein targets, fiber targets, healthy fat targets, and then supplement accordingly depending on how your diet is. Or change your
Okay.
diet.
Right, but I think we should be. I think it should be more focused on having like lean proteins than having like heavy carb or heavy fat proteins like red meats, right? Even though
Yeah,
you
for
get your
sure.
protein,
100%.
yeah, correct.
If someone said to me, you have to become vegan, I would probably become vegan, but I would still allow myself three things. I would allow myself low fat dairy for one because I can it's very difficult to be healthy and not be consuming low fat Greek yogurt. Number two, I would allow myself fish because it's very difficult to get your omega-3 intake without fish. Because even the so-called plant omega-3, what you get from olives, avocado seeds, and nuts is not EPA DHA, which is shown to be beneficial for your eyes, for your brain, and your heart. It is ALA, and depending upon genetic factors, only 1 to 10% of the ALA is converted into EPA and DHA. So if I was vegan, I would number one make sure I'm getting my 0% Greek yogurt and low fat dairy. I'd make sure I'm getting my fish and seafood or take omega-3 supplements. And number three, I'd probably consume 1 or 2 eggs a day as well, because there are some really healthy things within eggs, including choline and other kinds of multivitamin-like chemicals, which are very rare to find in other things. And there are some unique foods like eggs, mushrooms as well, which are very nutritious. They're like nature's multivitamins. Boiled egg and a mushroom is like nature's multivitamin. I'd probably not let go of my mushrooms and my boiled egg, even if I became vegan. Yeah. Right, that's enough for today, guys. Everyone, I'll see you next week. All right, take care. Bye bye.
Bye. Thank you.